Childbirth can be even more challenging during a pandemic. What can first-time expecting moms take note for this special day? And what can they do to take better care of their babies? Let's get tips from OB Gyne, Dr. Joy Kayaban. Doc, thank you so much for joining us. What stages of physical changes do women go through when they're expecting a baby?
Well, for the positives, most women feel more voluptuous. They have fuller breasts, and that makes them feel more positive about their bodies. On the other hand, some of the more bothersome symptoms, such as nausea and vomiting, they pee more often, they sometimes have low back pain, they're sluggish and sleepy. So those are on the negative side.
What are some kind of complications for women when they go through a pregnancy, Doc?
Lately, the more common complications that we see are related to diabetes, hypertension, and especially during childbirth, hemorrhage. And all of these problems can be mitigated, if that's a good word to use, by your regular prenatal checkup. So that's the one thing that you should never miss out on. Regular prenatal checkups do catch the hypertension earlier. Even gestational diabetes can be screened for earlier. And if there are risk factors for hemorrhage during delivery and even during the pregnancy, this can be seen also during regular prenatals.
For moms, of course, they go through a 9-month pregnancy period. What is the best diet for them during this stage?
Most would say, the studies would show that it's the Mediterranean diet that's most beneficial for most women because it has a balanced, it's more balanced. You have vegetables, you have fruits, you have poultry, fish, and especially fish and meat. And they discourage not too much on the sweets. That's the best thing I can say, because especially if you're a first-time mother, you don't know whether you're going to have normal vaginal delivery or a cesarean section. These problems of having babies too big for your pelvis to push through. This can be avoided by not eating too much of sweets and fats. I say that because especially now that we're having so many problems with women having gestational diabetes during pregnancy. That's one way of keeping the birth weight of your baby within normal, but not too big.
So, Doc, for first-time moms, how should they handle their newborn baby?
Okay, that's usually the mothers are guided by their own mothers, by the significant women who share in the care of the child. I suggest that the patient, the mothers, also listen to their pediatricians, have them see their babies often, especially when you're first feeding your baby, you're breastfeeding your child, and you don't know whether you're giving the baby enough milk or not. Your pediatrician will be able to guide you as to how much, if the baby is receiving or taking in enough milk or not.
Speaking of breastfeeding, which you just raised in your answer, what are the benefits of breastfeeding vis-a-vis formula milk?
Okay, so many studies have already proven that breastfed infants, especially those who have been breastfed for at least a year, they usually have higher IQ when compared with babies who have been bottle fed. That's if all things are equal, okay? And of course, it's more economical. You save at least maybe 50,000 to 180,000 per year because you don't need to buy milk, sterile water.
Right.
You don't need to, usually they have less infection. They get sick less often. And the mothers are also healthier So the savings is a lot. You have a healthier mom and a healthier baby when you breastfeed. But of course, it doesn't mean that when you're bottle feeding that you're not a good mom. No, it's the mother who decides whether breastfeeding or bottle feeding is good for her and her baby's situation. Thus, you just have to be guided by your pediatrician and your obstetrician.
Thank you so much for these very important tips and for sharing it with all our viewers tonight. OB Gynecologist Dr. Joy Kayaban. And you can get more health tips on MedTalk Health Talk, hosted by Dr. Freddy Gomez, with new episodes every Tuesday at 3:30 in the afternoon.